It's Children's Dental Health Month, and, you know, if you're a parent like I am, a lot of times you have a lot of questions about your kids' teeth because you don't know when you're supposed to start getting them checked or anything like that. And that's why joining us in the studio today, it's Dr. Laura Huling from Dental Associates. She's out of the Newtown office, but they also have offices in Danbury, Shelton, and New Milford. So, Laura, when should you start getting your kids' teeth checked?
So, it's really important to get kiddos in the dental office by age 1. The reason being is that childhood dental decay and tooth decay is actually the #1 chronic illness in children.
Wow.
It's more chronic than asthma, more prevalent than asthma, more prevalent than eczema. More kids have tooth decay than any other disease in the world.
I'm guessing that you can't put like that diaper rash stuff on the tooth when they're young like that.
Yeah, it doesn't work so well.
It's not going to cure anything. I understand.
So what do you do, because they barely have any teeth at that point, like what do you do when they come in?
So if the goal is to prevent the disease, really we're in there just to check the teeth for a couple of seconds. The majority of the conversation is about prevention. It's about diet, it's about proper hygiene, strategies to get your kiddo to brush their teeth, because you have a mom.
Right.
Totally know that sometimes it's a struggle.
Every night, still.
Absolutely.
Every night.
Yeah, absolutely. I'm a mom too, I get it.
Right.
But to go through those strategies and talk about the diet, hygiene, and the ways to really care about things is just the best way to do it right in the beginning to prevent what you can.
Now, does it matter at what age the kids' teeth start falling out? Because I know Hayden, my daughter, was a lot older than all the other kids, and then I started worrying that something was wrong.
So no, not necessarily. There are some things that can cause teeth to fall out at different ages that we'd want to intercept, and we'd want to intercept at a young age. But what we tell the kiddos, and what is really important to know, is that all kids grow at different paces, and all kids lose teeth at different ages. And just to instill that in the kiddos, that even though your friend's losing their teeth, it's okay, and that they'll lose them eventually. They'll lose their first teeth between the ages of 4 and 7. That's a long span.
Right.
So before kindergarten, first grade, sometimes second grade, they'll lose those first teeth.
She was freaking out because she thought, like, the tooth fairy was never going to appear. She was like, tooth fairy, I'm not going to get my money, I'm not going to do this.
She'll come. She'll come.
Is that payroll or development? It's just like, I've got to get it, I've got some items that I want, this kind of thing. Kids need to remember, like, this is the easiest it's ever going to get. When you only have 5 teeth in your mouth, brushing is easy.
Right.
Take advantage now, kids, all right?
And do they really need to floss? Like, she hates flossing, and part of me is like, you're going to lose those teeth anyway, let it go. But is that, like, not the right way to go about things?
Well, so as much as they lose their first teeth between the ages of 4 and 7, they'll keep their back teeth between the ages of 12 and 14. So those are going to be there for a long time. And baby teeth are teeth still. They still have feelings. They still get hurt if we don't take care of them well. They're super important. So we don't discriminate. Baby teeth are teeth too. We got to take care of them as well as we take care of our adult ones.
She does the same thing with a leased vehicle. You know, when she knows it's going back, she'll just hit things with it, that type of stuff. And
let it go.
Nor other maintenance, you know. She's just like, it's not going to be mine much longer. Can't really falter.
And listen, we have to be realists. I'm a mom too. I get it. Some days there are more important priorities, but as long as you're trying and you keep it on your brain to get in there as much as you can, it's the best thing you can do.
Now this is just like a personal random question. It's like my daughter's teeth, like they're coming in like the newer ones, but they look really crooked. But I mean, I never had braces. My husband never had braces. We never saw an orthodontist or anything like that. But she still didn't lose all the other ones yet. Like, when do you start worrying about stuff like that?
So it's a very interesting question. Back when we were growing up, you really didn't see the orthodontist until all your baby teeth fell out, and then you just dealt with what was there. The good thing is our teeth and our tongues do some natural orthodontics, but there are some concerns and some issues that we should really see the orthodontist a little earlier. So now the American Academy of Orthodontics actually recommends that kiddos come to see the orthodontist at around age 7. That way you can intercept some of the concerns and some of the problems, that you can prevent some of these bigger orthodontic issues when they're older. Most kiddos, they don't need treatment. Some kiddos do, and there are some things that if you guide their growth through orthodontics, they're going to end up better in the long run.
Right. So early prevention, detection in that situation could save you some pain down the road.
Oh, for everything.
It's Dr. Laura Huling from Dental Associates, and it's Children's Dental Health Month, so definitely go check her out. I mean, imagine how nice and warm she is. It's like easy to bring your kid to go see her, right? And it's star 99.9.